Hello, everyone, and welcome. Thank you for being here with me for this presentation. My name is Aaron Ander, and I have just completed my practicum with Selkirk Innovates, a division of Selkirk College. Jane, I really loved what you said as a mature student. It was great to go back and do some academic studies later on in my career. My academic focus is international global health. And I chose Selkirk Innovates for my practicum because they have a wide regional focus on population health indicators in their research and scope of practice. Prior to this degree, I was a student at Selkirk College, so it was my honor to return to that campus in a new capacity. A little bit of history. In 1964, an agreement between Canada and the US called the Columbia River Treaty was signed and led to the development and operation of 3 storage dams in the Upper Columbia River Basin for power and flood control in both countries. Cash benefits from the treaty afforded BC the development of power generation alongside these flood control dams. However, damage was done to the region in building these 3 initial dams in Canada, which flooded lands and displaced people. In 1995, through an act of legislation, the Columbia Basin Trust was formed to benefit the region, which was impacted most by these dams. The Columbia Basin Trust mandated area includes most of the watershed that flows into the Columbia River in Canada, a region that spans 80,000 kilometers, serving a population of 165,000 people. And the image on the left shows the Columbia Basin in the Canada side and US side of the border, and on the right is an image of the Columbia Basin in BC. It is important to recognize that Indigenous people were not consulted in the initial construction of these flood dams that had a major impact on their lives in traditional territories. Numerous First Nations cultural and archaeological sites were submerged. According to the Shuswap Nations Tribal Council, the original 1964 process in which decisions were made to enact the Columbia River Treaty by the provincial and federal governments excluded First Nations and Basin residents from providing input into a decision that had major impacts on their lives and life in the Columbia Basin. With that, I would like to acknowledge the traditional territories of the Ktunaxa, the Salish, the Sinites people, as well as the Okanagan and the Secwepemc Shuswap. Of note, the Columbia River Treaty is currently up for renegotiation, and the Canadian negotiating team includes not just representatives from the Government of Canada and BC, but also the Ktunaxa, Secwepemc, and Salish Okanagan nations are included as official observers in the process. According to the Shuswap National Tribal Council, the negotiating framework agreement set out for the treaty renegotiation between Canada and the US, quote, is a valuable precedent for participation in accordance with Article 18 of the United Nations Declaration on the Rights of Indigenous People, and also provides informed consent to Indigenous people before proceeding with economic development projects. For those who love logic models, here is shown how the State of the Basin initiative is situated within its larger framework. Funded by Columbia Basin Trust and held by Selkirk Innovates, the State of the Basin initiative provides, quote, access to data that Columbia Basin boundary communities and organizations can use to support evidence-based decision-making, leading to improved well-being in the region. And as you can see in the long-term outcomes, the intended impact of improved well-being in the region depends on evidence-based decision-making, which relies on access to timely and relevant data for community and organizations to act on. My task with State of the Basin was to update various community indicators. As an intern at Selkirk Innovates, I was presented with various indicators that needed review, analysis, and updating. Public data was made available for several community, health, and economic indicators, and my task was to update the information with current data and present the information for the general public to view on the website. And here are some examples. On the left is the number of employment insurance recipients for all regional districts in the Columbia Basin boundary, which shows a spike in the number of recipients in 2021. This is true for all of Canada and BC as well. And given what we've been through in the last 2 years, it's not surprising that that many people did apply for EI. On the right, we see the same surge in 2021 for these regional districts, but when looking at the numbers month by month, during the initial 6 months of the lockdown measures in 2020, we see a dramatic drop in EI rates from April through October, as many people opted for the more universal Canada Emergency Response Benefit. Then in October 2020, there is a sharp increase as CERB merges back into the EI program, followed by a period of increased eligibility. Drawing connections between policy and their impact on various communities in the region, we can see how the minimum wage compares to the true cost of living in 6 Columbia Basin boundary communities. From this information, we can ask, does the minimum wage provide enough income for a basic standard of living? The answer is that it depends on the region and the community. A nice example here is that $10 a day childcare program could have the impact of lowering the living wage by as much as $2 an hour. And you can see for some communities, a $2 an hour change to the living wage would mean the difference between earning a living wage and not when working for a minimum wage. In this practicum, I learned styles and ways to best visualize data for the public. Many of the analysts that came before me set examples that I could follow and model after. My supervisor and the project coordinator were always available to help with problem solving, though at times I enjoyed the challenge of working out these problems on my own. And I think the result from this practicum for me is realizing that I have a passion for and am very interested in the numbers and the data side of public health and epidemiology. And I do think that a master's in public health is in my not too distant future, but perhaps not for a year or so. Thank you to everybody for hearing my presentation, and a special thank you to the folks at Selkirk Innovates for their warm welcome, encouragement, and support. Thank you to all my instructors and peers in this program for such an engaging and wonderful learning experience. And I'm so glad to be here with all of you at the end of the journey. I'm going to open it up to questions or comments for anybody.